suspecting that you're in labor?
Yes. Yes, I am.
Okay, have you been having contractions?
Yes, and my water broke too.
About how long ago?
At 5 a.m.
Your water broke at 5
Yes.
a.m.? Was it a gush or did it just trickle down? Okay. How far apart are your contractions?
They were 7 to 10 minutes apart, lasting like 45 seconds. And I tried to lay down, but it wouldn't go away.
Okay.
So now they're like every 5 minutes and lasting longer. Like.
Okay, so it's progressed and
Yes,
gotten worse.
Yes.
Does anything help with the pain?
No, nothing. I tried laying down, like I said, and it's not working.
Okay.
I have so much pain in my lower back and I can take it.
Okay, so what we're going to do is we're going to take you into triage.
Okay.
We're just going to do a vaginal examination just to see how far along you are. And we're going to do a nitrogen test to make sure that your membranes have ruptured, and we'll do an ultrasound.
I can do whatever you have to do, but I need an epidural.
Okay, I understand. Like I said, we just have to confirm that you're in true labor, and then the doctor can do that for you.
Okay.
Ms. Cardenas, I just need you to sign some consent forms. One is for the Pitocin, and the other one is for C-section, which
will only be used in case of emergency. Yeah, my OB already explained those to me.
Okay, well just make sure you read all of it,
Okay.
and then we need a signature.
Okay.
Here. Thank you. And I'm just going to measure your fundal height. Okay. And then I also need to do a vaginal examination to see how far you've dilated.
Okay. When am I gonna get my epidural?
You'll get it soon.
Okay.
So you're at 5 centimeters now, which is great. So you're doing a good job.
Alright, thanks.
Where's my student nurse? Oh, there you are. I wanted to show you the strip. So since our patient is in advanced labor, you can see that her contractions are about 4 to 5 minutes apart, and they're each lasting about 45 seconds. And then on the top section, you see the fetal heart rate. For both of the babies, it's actually at about 140, which is reassuring and with moderate variability. And earlier I checked her dilation. She was 5 centimeters dilated with 50% effacement at a -2 station. So everything is progressing normally. So Ms. Cardenas, everything is progressing normally.
Okay.
You're doing great. Your anesthesiologist will actually be here shortly to give you that epidural. So that'll make you feel a lot better.
Okay.
And I'll continue to check back on you.
Come on!
Ms. Cardenas,
Eat it!
I just have to do a vaginal examination.
Oh, okay, go ahead. This is the last one. You better get it. Get it. Ah!
Ms. Cardenas?
Seriously? I need to pass this level.
Ms. Cardenas? Ms. Cardenas?
Okay, sorry.
So I just need to inform you, you haven't dilated the past 2 hours.
Really?
Yes. So per doctor's orders, I'm going to have to start you on Pitocin. This will augment your
Pitocin.
contractions and help move things further along.
Okay.
But I do need to warn you that if this doesn't work, the doctor might have to do a C-section on you since a couple hours have already passed, your membranes have ruptured, and we don't want to risk any infection.
Yeah, that's true. I really didn't want a C-section, but this better work.
Okay, well, we're hoping that it does work.
Alright.
Why is she not dilating?
Well, many times with the multifetal pregnancy, labor progresses normally, and then the frequency and the strength of the contractions actually decreases. And this is due to the overdistended uterus with her multifetal pregnancy. It's known as hypotonic uterine dysfunction. And you can actually tell here that the contractions had started normally, and then they start getting farther apart, and their strength actually decreases. And this is known as dystocia.
What is dystocia?
Well, dystocia refers to abnormal or difficult labor. And this is what our patient is experiencing. She has many risk factors that contributed to it. She's nullipara, carrying twins. Her epidural was given pretty early. She also is experiencing a prolonged first stage of labor with the ineffective uterine contractions. And all of these contributed to dystocia. Many times we actually don't know that a patient is going to experience dystocia, and certain forms can only be determined through our proper labor assessments. So that's why it's very important to always do those.
Oh, okay.
Nurse, come in, please.
Yes?
I'm just so worried. What's going on? I mean, how much have I dilated now that I'm getting pitocin?
Let me check. First, let me go ahead and take your temperature.
Okay.
And I'll do the vaginal examination. Unfortunately, you actually have not dilated. And then you also have a slight fever. So I'm going to have to let the doctor know. And I am seeing an elevated fetal heart rate on both of them, and your heart rate is a little bit elevated as well. So I'm going to notify the doctor. He might decide to proceed with the C-section.
Oh no!